Okay, actually, we're having some discussion. We actually think the godlike teachers are the ones who are doing middle school, because that's when kids get real crazy. By high school, it's like, ready or not, here they come, get them out to the world. All right, scoliosis is a condition of the spine that doesn't necessarily cause pain. Sometimes it's hard to know if you even have it. So what are the warning signs, and when should someone head to the doctor? Dr. Timothy Borden, orthopedic surgeon at UT Physicians, stopped by with some answers. A lot of us who always remember that kid in school who had scoliosis, but none of us really knew what it was. So let's start with the definition.
Yeah, absolutely. So scoliosis is a three-dimensional rotational and angular change in the spine that you notice from the back. And that results in a curvature of the spine that can cause problems later in life.
Yeah, and you can literally, like we can look right there, we can see it. You can literally see it on someone's back, but it doesn't start out that way. It happens gradually, right?
Typically that's the case. So the most commonly this is a condition that comes around in adolescence, and as children are hitting their peak growth spurt, the condition can become worse and those curves can get bigger as they grow.
Yeah, all right. So there are some common misconceptions. One is that we were talking earlier, carrying heavy things.
Yeah, so adolescent scoliosis, the one that is most common, over 80% of it is idiopathic, meaning undetermined causes. But they have shown that carrying a backpack, posture, activities that you do are not related at all to the development of scoliosis.
All right, another myth is that, okay, you got to be fragile, you can't play sports, you can't do any of those things, that'll exacerbate it.
No, so children with scoliosis are very active, they play sports. Even if they are required to wear a brace, they can still maintain all the activities that they were doing before.
I would imagine, like a lot of things, the earlier you detect it, the easier treatment could be.
Yes, absolutely. Early detection is key, and what you're really looking for is any sort of asymmetry in shoulder height, any sort of shifting of the torso from side to side. And the screening test we do in the office is a forward bending test where children bend down as if they're touching their toes. And that's how we really detect it clinically. You see this asymmetry where the ribs can actually be a little bit higher on one side than the other.
All right, so when it comes to treatment, and I know a young girl who went through this, and it's kind of tough on a tween, right, girl especially. In fact, girls are mostly affected with this, right?
That's absolutely correct,
yeah.
Yes.
And so she was like, okay, I have to wear this brace, but a little patience might be involved here, but you can get great results with treatment.
Absolutely. So the braces that today are all custom made, designed to fit the individual child. They are usually worn underneath the clothes, so they can be somewhat less
yeah, you really couldn't tell when she was dressed. You couldn't tell.
Exactly, exactly. And when worn appropriately, about 90% of scoliosis cases can be stopped from getting worse.
All right, so the brace will basically straighten things back out. What other treatment options are there?
Yeah, so there are a lot of other treatment options out there, chiropractic care, physical therapy, and a lot of these different alternative therapies are really great when combined with scientifically proven cases, and they shouldn't stand in the way of seeing a pediatric scoliosis surgeon to monitor your care going forward.
And sometimes surgery is required.
Yes, so unfortunately some percentage of kids either have a very large curve when they come to see us in the office, or their curve gets worse with time, and then we resort to surgery, and that involves using rods and screws into the spine to help straighten it, and that allows for preventing further problems down the line.
Yeah, what happens when somebody does nothing?
So when you do nothing, those curves can continue to get worse, and what we worry about is not necessarily in your 20s or 30s, but later on in life when the curves can get really bad and get over 90 degrees and start to cause problems with breathing, lungs,
mobility, even
back pain, mobility, and really can destroy your life later on.
Yeah. So if you're concerned about it, just get checked now. Can any doctor check this, or do you send them just to get the screening to an orthopedic?
Yeah, so any doctors can check, your pediatrician can check, but if there's ever a concern, the easiest thing is to see a pediatric scoliosis surgeon, and they can take a quick x-ray and talk about all the options, and really that's where the expertise is in this area, and it's really easy to get in and be seen.
And fairly easy to get it fixed eventually.
And yeah, fairly easy to get it fixed, exactly.
All right, thank you very much. If you would like your child screened for scoliosis, give UT Physicians a call at 713-486-7500, 713-486-7500, or visit them online at utphysicians.com.